Hi everyone, good evening to all of you. Am I visible and audible? Can I have that answer in the chat box, please? Can you please let me know? Am I visible and audible to all of you? Okay, great, perfect. And can you see my things written on the slides? Can you see the scribbling? Okay, great, perfect. Thank you so much for letting me know. And I'm glad you all have joined this webinar. And over here, I'll be talking about the strategies. I'll be talking about how to prepare for MRCP Part 2, which is nowadays somewhat difficult. I'll not say very difficult, but yes, to be honest, it is somewhat difficult now. The scenario has changed for what it used to have around 3 or 4 years back. So definitely every other diet they keep changing the pattern. And today I'll talk about more about the recent diet, because when we are writing exam, we need to know the pattern. We can't just go ahead diving deep into the theory, into the knowledge, into the questions without knowing the pattern. You have to know what is going on. How are the questions being asked? What are becomes important? And that is very, I mean, you can't escape. You can't have any other alternative. You have to know the pattern. You have to know how the questions are being asked, and now how to prepare. Because if you directly jump onto the second step, preparing, okay, I'll just start preparing for my examination. No, that is not what matters. You have to know the pattern. Okay, so I'll be talking everything about the recent diet, the important clues, important hints, important questions which have been asked on the recent diet also, by the way. If you all are interested, how many of you are interested in discussing the questions? Can I know your answers in the chat box? And whenever I take a webinar or any session, I always ask for those interaction, that how much are you interested, and can I have the score out of 10? Maybe 1, 2, 5, 10,000 out of 10. How much are you interested? Okay. I can see those answers coming. Oh, wow. Dr. Mirabel, wow. I can't even count the zeros in your answer, Dr. Mirabel. Okay. Great. Perfect. I'm happy to see that excitement, because obviously that is what is needed, right? Whenever you are starting anything, whenever you are reading or practicing any question, you have to have that motivation, you have to have that excitement. Otherwise, it just feels like a burden. And when I talk about the MRCP pathway, the MRCP journey, it should be a very interesting one, not a burden to your mind, to your body. Because when you take it as a burden, you're not learning, you're just reading for the sake of it, for the sake of clearing examination, and your output decreases. This output, I'm not talking in terms of just the questions or the exam pass or fail. I'm talking the output in terms of your clinical correlation, and obviously helping you in your day-to-day practice, right? Because when we talk about MRCP, when you obviously dived into this, MRCP is because of obviously building your career, having that boost in your CV, plus having that confidence in yourself to manage the patient. Okay, now without wasting much time, I'll just start. The very first thing when I talk about the exam, nowadays I'm getting so many questions and so many DMs or messages regarding, so we practiced many questions, we practiced 5,000, 10,000 from different resources, different Q banks, but we were not able to make, and we were not able to pass the examination. So the main thing about this exam is how you read, how you decide, and what you consider safe. That is very important. And nowadays, as I mentioned earlier, is change in the pattern. The first thing nowadays is they are giving more confusing stems. The stems are very much tricky, are very much challenging, with the last option having similar answer choices, almost similar, and people are actually getting confused that okay, now we are left with 2 or 3 options. Which one to select? Which is the more likely option, the correct option, right? So these are the two. Plus, add on, definitely you have the time pressure, which you already did in your part one, right? You managed to do that, and thankfully you cleared your part one, and now likewise you will clear your part two also, to have that confidence, right? But at the side of the confidence, you need to have a strategy, you need to have a smarter plan, not just a hard work, a smarter plan for that. And plus, nowadays, obviously, they are talking more on the decision flow. And when I talk about the number, approximate number, it revolves around 120 to 125 out of 200, right? So you have two papers which I believe everyone knows, and you all have given your part one. It's almost the same part. The other important thing which is there now in part two, first of all, it's part two, it's stage two. It cannot be similar that part one. And some other people, some other doctors, they make mistake. The scenario which they did in the previous attempt, in the previous part one, they try to simulate in the part two. Not at all. It's actually very different. When I say different, the one thing is the confusing stem. Second, add on are the images. So image based questions. I don't know how many of you wrote the exam this diet, the recent diet. How many of you, by the way, have written the exam in July? 15th of July. So we have the exam. So how many of you wrote that exam? Anyone who wrote that exam and is here? Okay. Not okay. Dr. Ani is there. Okay. So no worries. Okay. So now, if I talk about images, the image-based questions, this diet, the recent diet, had around 38 to 40 images in the exam, which again is a change in pattern. For the previous two diets, they were giving around 25 to 30. This time they increased it to 40. 40 images. That means in each paper, there were 20 images, right? So that means 20% of your paper has image-based questions, which includes ECGs, CT scans. It was asked CT scans, and the MRIs were asked many. There were many CTs and MRI, plus X-rays were there. And obviously you have the off the images. There were two off the images, there were one DEMA image. So you need to know the pattern, how the pattern is evolving, how they are changing the pattern, and what is being asked, where to stress upon. So images definitely is important, is somewhat difficult. And when you talk about the image based question, there is no end to it. When I talk about ECGs, when I talk about the CT scans or MRI or X-rays, there is no end. There are many images on internet and in your resources, but you need to know how to approach, what to see, how to see that, and how to interpret those images. That is more important. That just saves your time, not while preparing, in fact in your exam also, because once a question is there, you feel, okay, this is the image I already saw, this is the image I know it, and that somehow saves your time. And along with your time is your pressure on the brain, because the more you can relate to what you have read, what you have seen, you feel less pressurized. You feel, okay, your brain cells are working, they're not about to die. Otherwise what happens is your brain cells starve that motivation, that where is the question which I prepared. I can't see any of the question which I prepared for, right? I can't see those topics, I'm still confused. So you have to give that energy to your brain cells as well, right? So neurons. So anyhow, so I would just say, by the way, people keep asking and doctors keep asking about what is the cutoff. Is it 121, 125, 130? I would say it doesn't matter. I've just taken this from the resource, right, from the RCP, but it doesn't matter. It depends again upon the equating system. And now, when we talk about the scoring system, it is about usually around 62% or more that classifies or that qualifies as the pass. So you can't just estimate how many questions, right? And you should not prepare in that manner, by the way, right? You should have a full structured approach, that I have to give equal weightage to each and every examination. And now, when I talk about the previous year, I mentioned about images number. The other thing which I saw in the recent diet is there were many questions from pulmonology. Many questions from pulmonology. Second was nephro. Third was gastro. Now, I wouldn't say, some people, they have a habit that, okay, if I just talking and telling in the webinar that, okay, pulmonology was the most asked question. That doesn't say that you have to prepare for your diet in this manner itself. Not at all. Again, why I wrote those units, those specialities, is letting you know this is what they asked. In the next diet, they will again change. So you can't just stress upon in this whole paper, 200 paper, there was just 8 to 10 neuro questions, which was unexpected. In the previous diet, there were around 15 to 20 questions. So again, this is what I'm saying is your approach should be very much towards covering every other specialty, not just emphasizing on one. That, okay, I'll just emphasize on pulmonology this time. I'll emphasize on neurology, not at all. It should be very, very structured, and you have to give equal importance and weightage to each unit. So that is, I thought I'll start with letting you know how it was asked in the previous diet, how the pattern has been changed in the recent diet, by the way. Now, when I talk about the trap, the preparation trap, right? So this is important. This is important. That usually what we do is reading textbooks without practicing questions. Somehow doctors have that kind of mindset that, okay, I'll just keep adding information, adding knowledge to my whatever base I have or whatever foundation I have. I'll just keep adding that information. Again, no. For part two, yes. Practicing the questions is very, very, very important. You can't escape it. Some other people, they have a tendency of just practicing the question without knowing the theory, without even understanding what is being asked in the exam or how it is being asked or what is the whole topic about. If I talk about neuro, yes, if you are reading a topic about a brain abscess, you need to know how a brain abscess looks like on an MRI, on let's say on an MRI T1, T2 flare image, how it looks like, and now how you differentiate this with the similar looking finding, which is very commonly a GBM. So if you are not sure, because in the exam, what I have seen, what they do is they will give almost similar scenario and you'll be confused. Only one thing which just differentiates is the MRI finding. And if you are unaware that how it differentiates, gone. And you will be stuck with that particular question. And that is what pressure keeps building up, right? That timer, when you have a timer on, you can't just keep thinking for 2 minutes to 3 minutes, not at all. The whole paper is of 180 minutes. You can't even take 2 minutes on a particular question. It should be less than that always, right? Your strategy should be, okay, I'll just complete my question. I'll just move on to the next one in maximum 1 to 1.5 minutes. That's it. I have to complete whole of the paper. Right. So I'll talk more about it as well. Missing subtle clues and ignoring the pattern recognition. This is what I just mentioned, that some people, they miss the pattern recognition. And I'll talk in the next few slides. I have few questions which were difficult, which some of the candidates felt it was a difficult one, but it was a pattern. It was there, right? And I discussed those things, and my team, Dr. Arshia is also there. Dr. Hani is also there, by the way, as a faculty. So we discussed those questions, those probable questions which we expected, and they actually came in the exam, right? So I'll just show it to you as well. So until unless you don't know what about the pattern, it doesn't make sense, right? You are investing your time. So always think about what are the subtle clues and pattern recognition for that particular question, right? For your whole preparation, obviously you need to know the pattern as well. Then what becomes a struggle in the exam is poor time management, right? This is what I'm talking about. And whenever you have some long minutes, then yeah, it somehow creates more trouble. And nowadays, they are not much lengthy questions. They are 3 4 liners. And yes, some other ones which were long stems this time, right? So which were not there in the previous 2 3 diets. So again, that is unpredictable, right? But you have to prepare in a manner that yes, you are able to manage your time every now and then. Because at this point of time, if I give you a question about let's say brain abscess or prolactinoma or non-functioning prolactinoma, so you will be able to answer, right? But have you seen how much have you taken the time for answering that question? That is what matters. So that timer is important, right? Whenever you practice, whenever you go with, especially for part two, I'm not talking about the part one. If you are going with part two, you have to take care of your timer. And when you study, let's say you are in your hospital, let's say you are somewhat occupied, right? You are not giving whole of your attention. You can't give whole of your attention. I would just say, just scan the question, just try to answer those questions and see how much is the time taken. That's it. Set aside 10 questions for yourself. how much are the time, how much is the time you have taken. It should complete in a matter of 18 minutes, less than that, right? Because in the exam, you need to have some buffer time for you to see and check your flagged question, for you to see somehow some things happen, right? Unpredictable things happen. And nowadays, fortunately, unfortunately, they have the center-based examination. So you need to, right? Sometimes an invigilator comes, an examiner comes, or some other person in the examination hall gets I have heard many things that a person in the exam got fit and seizures and he collapsed and all those. So that waste your time, right? Or some other people have GI upset or many things. So always try to keep 15 minutes aside as a buffer time for yourself, right? So that helps you relax, that helps you see the questions again which you might have flagged. And always make it a point that you always flag this question, do not just stick to a particular. So this time management is actually very important when I talk about part 2. Some of the people, some of the doctors struggle in part 1 also, but it's not everyone. In part 2, I would say 90% candidates struggle with the time. Why? Because the question is so much tricky, the options are so much tricky. So as to have that efficient time management, you always have to have a timer whenever you are practicing. You have to train your mind in the similar manner that yes, this is the way I will train my mind, right? So you have to have that timed session for yourselves, or if you have those mock exams, that is the best scenario. That set aside this is the time for myself, let's say 1.5 hours, and I will complete 50 questions. And later on, I'll just go with the explanations. That should be the goal. That should be the approach when we talk about MRCP part 2 prep. So this is again, I would just say very important when I mention about the part 2. Next is overthinking and misinterpretation. Overthinking, when I say, definitely it is required. In part 2, you have to overthink. But some other people, they just keep going into too much of depth. That is where some other people they carry on with choosing a wrong option, which is not to be done, right? Plus misinterpretation. So you need to interpret the values. Let's say it's about the PFT. This time there were many questions about the PFTs, and thankfully I was very happy and very glad. Today itself I had a word with one of the candidates from our previous batch, and he was like, we have practiced so many PFTs that yeah, it was easy to evaluate. What about FEV1, FVC, and then the KCO, then the ratio, how to evaluate, even if it is given in even in the standard deviation form also. But yes, you need to know what are the values, how to evaluate. Was it initially a restrictive one and now a obstructive one, right? So this was the scenario given in this diet. So until unless you're not sure, until unless you don't know how to interpret, it becomes difficult. When I say PFTs, there were many questions about the hormonal values. There were many questions about the liver functions. So people were getting confused. But ultimately, what you need to know is how to interpret from those values being provided. So this is again interpretation of the let's say hormone values, the electrolyte values, the PFTs, the ABGs. So once you know how to interpret it, it becomes very easy, right? So you have to have a thorough approach, not just this is the question which is present in your Q bank, in your resource, and you just try to memorize, you just try to ratify. That will not help you. That will actually make you struggle because your mind is just trying to answer what you saw, but you don't know the approach, you don't know the concept, you don't know how to interpret these values. That is important. Interpreting the values is very important, and that just saves your time. And those are very productive, by the way. In the exam, if I talk about the questions which are difficult to interpret, those are very scoring because of the equating system. I believe everyone knows about it. Then the next problem which usually people encounter is answering from the habit, not from the guidelines. So if you are not well versed, if you have not seen those algorithms, those guidelines, the nice guidelines, it becomes tricky, it becomes difficult. Let's say I believe all those who are attending it, they know about the change in the diabetes management, the change in the heart failure management. So until unless you're not aware, until unless you have not practiced questions in that particular manner, or let's say there's a change in the asthma guidelines also. So it's been I think it's been more than a year than asthma guideline has been changed. So if you have not practiced question in that regard, it becomes difficult because your mind actually goes in the same direction which you are practicing. Or if I talk about pneumothorax, your mind again goes in the same direction. So, but what you need to be well versed with are the guidelines, the nice guidelines. That is more important, right? So this is a vicious cycle, by the way, of where people struggle, where people were not able to clear the exam. So these are the things which everyone, so you can take a screenshot, so everyone should be able to avoid these, and I'll help you how to strategize, right? And this ultimately whole vicious cycle, what it leads to is a lack of confidence despite studying, despite taking out hours on your daily basis. And I know when we are preparing for this exam, we are much busy in our schedule. We have hectic duties, uh, we have on calls, we work, let's say, working full time, and you have your social responsibilities. When you go back home, you again have those responsibilities, right? Taking care of your family, of your household chores, and many other things. So we don't have, and plus, not to forget is the Instagram, right? So it somehow, I mean, your thumb goes towards Instagram, scrolling reels and whatnot, right? But the thing is, you have to concentrate. You have to know, okay, this is what is to be done. Once you know the summary, once you know, okay, this is how I have to practice, it becomes easy and it becomes more productive because you know what is to be done, right? Okay, now when I say next is the workflow, how you should recognize and how you should see those questions or your preparation. First of all, the first step is always you have to study, and that too the theory, the knowledge. Do not directly jump onto the step two, practicing the question. I've seen many people struggling with part one, with part two, and they directly jump onto the question, and it matters. Let's say you are scoring 40%, 50%. That percentage doesn't matter, by the way, which you have seen already, right? Some of you who might have given the exam, it doesn't matter whether you are scoring 50 or 55 or 60 or 65 or 40, even 40 also, right? What matters is, do you know the high yield points, and do you know that whole topic or not? And do you know the guidelines related to that particular topic? That is what matters, right? The whole topic, not just one point. If I talk about HRS, right, you need to know why it happens, how to diagnose it. It's a diagnosis of exclusion, and what should be excluded, first of all, so that you come to a diagnosis of HRS, right? Then how to manage, what are the types of it, what are the prognostic factors. So until unless you're not aware of these things, it becomes difficult. If you just know, okay, I have seen a question about HRS and the answer was albumin or a terlipressin, that doesn't work, that will not work, because you don't know what terlipressin is doing, right? I'm just giving an example. If you know it, perfect, right? Let's say I very commonly I just keep saying aspergilloma versus invasive aspergillosis, right? So there was a question and everyone was confused, right? But yeah, I discussed that in one of our sessions. So I'm not talking about the recent diet. It came in 3 diets back. So aspergilloma, invasive aspergillosis, it looks similar, right? And what they gave in the exam is there's a fungal ball and all those things, which can happen in invasive aspergillosis also. But what was also additionally given is patient had fever and there was neutropenia, which directly takes the scenario towards invasive aspergillosis. That's it. Everything else looked similar to the aspergilloma. So aspergilloma has the fungal ball, patient present with just hemopsis. It cannot be fever because it's a localized lesion. It is just the fungal ball which is invading the pulmonary vessels, and that just creates hemopsis. Patient present just with hemopsis. There can't be fever. When they say moderate fever, it cannot be aspergilloma. And when I talk about invasive aspergillosis, yes, it just invade into the vascular system, right? And in the systemic vasculature also, causing neutropenia, plus all the systemic features. And very commonly, they have a history of immunosuppressant. But in that particular type, they have not given the history, mind you. What they gave is neutropenia and a moderate fever. That's it. And the answer changes to invasive aspergillosis. So these are very subtle things. Until unless you're not aware of the whole topic, this is what I'm saying. Until unless you don't have that knowledge, until unless you are not aware of that whole topic, then yes, it becomes difficult in the examination to rule out two options. And according to a candidate, according to a doctor who have answered in the exam, in the actual exam, also he or she feels okay. The question was about a patient presented with a fungal ball. It was previous history of TB also written. Fungal ball was written. Hemopsis were written. Answer is aspergilloma. No, the answer was something else, and that is what creates trouble. And then somehow some other doctors, they go into that kind of thing that, oh, we practice so many questions, still we are not able to. Why? Because you directly jump onto this practicing the question, which should not be, because our mind just sees what we have seen as a question. It's just like when you think about buying a car, right? Initially you might not see much on the road, but when you think about a particular car or a particular brand, then on the road itself you can see many cars, and that is what matters. So when you practice, directly practice, you just, your vision is very much narrowed, right? You don't know about the whole theory. So I would again say, please and please always think about having read about a topic and then only going on practicing the question. And that too, daily time blocks with a previous year question, because previous year question is important. The pattern, you get to know the pattern just from seeing the previous year questions or the previous year topics or the previous year scenarios, right? Because again, in part two, some of the candidates are not able to recall because the stem is somewhat confusing. But yes, what matters is what are the topic being asked in the examination, which we keep discussing in our session, right? That is very helpful. Then once we have practiced, now you review it. And when you are reviewing, it's not about how much you scored. Is it 8 out of 10 or 7 out of 10 or 4 out of 10 or 10 out of 10? It's not about how much you scored. Why? Because it's not giving you the answer whether you will pass or fail. Not at all. Do not just keep analyzing and going in either of the emotion. A positive emotion when you are scoring 8 out of 10 or 9 out of 10 or something like that, or maybe a negative emotion when you have scored, oh, just 3 out of 10 or 4 out of 10 or 5 out of 10, and you are somewhat discouraged. So somehow we just tend to analyze our prep based on those scores, but that doesn't matter. What matters is the questions which you marked incorrect, which let's say you thought about a particular option and that is the incorrect one. You have to look the other options, that why the other options are incorrect or why the other option is the correct one, right? So unless you are not seeing, even if let's say your score is 8 out of 10 and you missed seeing why the other options are incorrect, that again just takes away the message, right? That your effort goes in vain, right? So always have a habit. uh Hi, Doctor. I like the way you give examples. Good to hear you again. Thank you, Dr. Shoaib. Thank you so much. Yeah. So what I would always say is whenever you are answering or whenever you are practicing a question, it's not about how much you scored or whether you scored as correct or incorrect. Your funda, your scenario should be, or your goal should be, why the other options were incorrect, even if you marked it correct. So don't go into a positive emotion or don't go into the other euphoric feeling that, oh, I'm a master of pulmonology, I'm a master of cardiology, I'm scoring 80% in my cardiology block or pulmonology block, right? So that is a somewhat negative, right? Although it's a positive emotion, but that is a negative that is impacting negatively for your exam. Why? Because you are being lenient and you are avoiding the other facts. You are avoiding what is to be known and why the other options are incorrect, right? So that's about the third. Then recognizing the patterns, develop the flag and move on strategy. That is again which should be practiced multiple times. In the exam, some other candidates, they have trouble regarding the same by sticking towards a particular question, and they can't move, right? And some other times we doctors, we have something like a FOMO feeling or a OCD, right? Somehow we are in between, right? Sometimes we have okay, we are missing out something, or we just keep checking the question again and again. Oh, this is a neuro question. Oh, this is the image. I know this image. I have seen this kind of a MRI. I know what is a supracellular mass, how it looks like, and whatnot, right? So you get stuck to it. But the strategy for clearing exam with a good marks, when I talk about in my session or in my webinars also, it's not about just pass. It is about passing with good marks. You should know the strategy to clear it in the one go itself, and that too with the great marks. That is done whenever you are confused, flag the question and move on. That is again, we have to, right, as a doctors, we have to practice, because we are not practicing that in our daily practice, right, in our daily schedule when we are managing a patient. But over here in the exam, if you are sticking to a particular question and you are wasting your 2 minutes, 3 minutes, 4 minutes on a particular question, I mean, you are compromising other questions, which again is a major problem. Or you can say it's a suicidal thing in the exam. You can't even take out 5 minutes for a particular question. Cannot, right? So you have to have a art of flagging the question and moving on. Then the another thing which many other candidates struggle is the revision. Some of the time when you are preparing for your exam, we have that kind of intent or that kind of enthusiasm when we start. Oh, we will just finish 2 Q banks, we will finish 3 Q bank. I've taken subscription for 2 3 Q banks, right? Or the resources, now I have gathered all the resources, I have all the PDFs with me, and I'll just finish pulmonology like hell. I'll have taken 7 days leave from my job and all those things, right? But what you are doing is at that particular week, maybe because of your enthusiasm, your motivation, your free time, you are able to. But what these candidates struggle is how to revise when you have read from different resources. And nowadays, that another resource which is added to the list is ChatGPT or Gemini or Claude nowadays, right? So this has been added to the list, by the way, isn't it? Which one is your favorite nowadays? Is it ChatGPT, Claude, or Gemini? Or you are still not? You are like, okay, I'll just leave it. I am the one. Nobody can help me. I mean, no machines, no AI can help me. Can I have that answer? Which one do you love? Chat GPT? Okay, okay. What about others? Any fan of okay, Copilot also. Okay, perfect. Anyone fan of Claude? Oh, I can see Claude also. Great, perfect. Mix of oh yeah, Hani. Hi, Dr. Hani. Thank you so much. Intellect Medicals. Okay, great. So I know. Sometimes we have these resources which helps us, right, to understand maybe concept or simplify. But at that point of time, you might have taken a help from ChatGPT or Claude or whatever AI you are using. But at the end, before your exam, right, when I'm talking about those last 15 days, last 20 days, critical days, you'll not be able to revise, you'll not be able to search what you have asked for or what table you had and whatever the things you asked from ChatGPT, right? So that point is very important, that you have to have everything consolidated, you have to have a summary, and you need to know that this is my structure, this is my notes or my resource which I will refer for revision before my examination. That is again very important, because last, this is I have written as a last, right, the fifth point before going for a success, right? Because everyone wants that success and everyone succeeds also if they actually work in the same manner, right? Until as you are not working on the fifth point or any of the pillar, any of the thing which is mentioned, I mean, it doesn't make sense, right? So you have to have a structure where you start with studying the theory, understanding the theory, understanding the concept, understanding a topic altogether, right? The histology. When I talk about, let's say, a difference table, yes, you need to know how you differentiate other closely related topics or the closely related pathologies. Once you know it, now jump on to the practicing the questions. And always when I say practicing, again, I'm just re-emphasizing those points, because this slide is the most important, I would say, right? That this is how you should practice, this is how you should go forward for your management or for your passing the examination. So practice, but that practice should be timed always. For part two, it should be always timed, right? Do not just go with the random ones. It's not part one. Again, I'm saying the same fact, right? It's not random, it should not be random, it should not be okay, I'll just start it. No, it should be always timed practice modules, right? Then you have to review, you have to see your questions, plus always look for the PYQs. If you are missing PYQs, if you don't know what the questions being asked in the previous examination, again, you are missing the point, the main point, that this is what was asked in the previous diet. And always in the future diet, some other questions, the difficult ones, are there in the next diet as well, right? So review, recognize the pattern, have that strategy, how to flag, move on, and practicing in a timed manner, in a mock condition, just like the actual examination. Because some other time you might be just reviewing, seeing those questions, practicing those questions, but once in a while, every other week, you have to have a pattern that, okay, I'll just sit down, take out my time, 1.5 hours from my busy schedule, and I'll just try practicing as a mock. Because the more you practice, let's say we have all those, right? I believe many of us, we might have just seen and over with the FIFA fever, right? So many of us. So I'm not going into a discussion about Argentina or whatever, right? Yeah, Spain versus, and so whatever the thing is, but yeah, or let's say we talk about cricket or any other games, they always go for practicing before the main day also, right? The Ronaldo or Messi or any other great player, Haaland or whatever the player is, or Sachin Tendulkar, they also practice it, because you need to practice in the similar manner, in the similar condition as the exam. Until unless you don't practice, your mind is not being trained. You are just going random. So the more you practice, the more you analyze, and that analysis should not be how much you scored. The analysis should change. So it is just a change of the mindset. That analysis should be, what are the other options, and I have to understand that, right? The whole topic, and then having a strategy being made for revision. Until unless you don't have a strategy for revision, until unless you don't have those resources which you have to again repeatedly see, again you are losing the point. Now, uh, the next one is the 6-step filtering funnel. When I talk about, now I'm talking about that was how you should practice, how you should go ahead and strategize your whole preparation, the previous slide. This slide is talking about how to come on to the conclusion of a particular question. When you are going with a particular question, how you should approach. Very commonly for part two, by the way, fortunately, unfortunately, we have messy, distractor rich clinical minutes. Many, right? And this Messi is not Argentina's Messi. It is the messy question, the mess which is created by RCP in that particular question. And you are totally confused. What the hell are they asking? What they do want from us? Right? So that's, and they are distractor rich also. There are many distractors provided in the questions, right? Whether it is just that they have the distractor in one line or two lines, but they usually have the distractor, especially in the part two. So first thing should be, read the actual question first, right? And mainly the last line. With the actual question first is the last line. What are they talking? What are they asking from you? Is it the investigation? Is it the diagnosis? Is it the treatment plan? What are they talking? So that gives you analysis that somehow narrows down the approach. Okay, they are asking for a investigation, right? And that to investigation as a next best or most appropriate or definitive or gold standard. These are the another phrases they somehow play with, right? So read the last stem, identify the clue which is given, and highlight the red flag. So now you can just see, okay, this is a red flag which is provided. You have to remove the distractor, and out of this whole, which I have already mentioned, is rule out the options. In part two, you cannot just read the stem and what is being asked, and let's say you are coming with the answer as hyponatremia and you just mark and go on to the next one. It doesn't work. You should not. Until unless you don't you haven't ruled out the other options, then yes, please do not mark and move on. Rule out and then move on. Right. So the main thing about this whole slide, I would say, is the fifth point. Until unless you have not ruled out, you cannot move on to the next one. This should be your strategy. This should be your, I mean, you have to learn this art for part two. This is what is required in part two exam. Okay. Now, how many of you are interested, by the way, for the question? Should we start our questions? I have, I think, 3, 4, 5, something like that. And if you're interested, it's almost about to be 1 hour or so. Okay. 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 Just few of you. What about the rest? What about the rest? Where are you at the moment? Physically, mentally? Are you on Instagram, Facebook, YouTube? Tell me. or Netflix, the favorite one nowadays? And if it is Netflix, tell me, do let me know the best episode nowadays. I'll also watch. Okay, so great. Okay, great. On it like medical. Okay, thank you so much. Okay, now this is the question asked. Although I have mentioned in this pattern, this is obviously not a pattern as a history and examination. I've just tried to help you. Now just read this and see the CT scan attached as well. Just take your time, but not more than that, right? I'll just start a poll, by the way. Till the time you just read, you will have a poll in front of you. I'll show the options also. Okay, I believe you might have read, you might have seen. I'll just enlarge this one. I'll just zoom in so that you can see what the CT is. Okay, I believe now you might have seen. And these were the options provided in the exam. And once you see it, I'll just start. So you have the poll in front of yourself. And please do not annotate on the slide. I'll just request. I know sometimes it happens, but yeah, try not to. Okay, can I have the answer, please? Anyone which you feel like A, B, C, D, E, whichever you feel, okay, this sounds interesting. This sounds great to me. This looks very shiny to me, this particular option. Okay, I can see. Okay, honeycombing of the CT, great, perfect. C, D, C, 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 great, great. ILD, everyone knows that this is ILD, but which kind of a ILD? So is it okay? And why not? If I talk about why not COP, and this was asked in the recent diet. There were two questions, by the way, of ILD in the recent diet. One is this one, the other one is about COP. What about COP now? Why not COP? If at all your answer is C, because I believe everyone is like ILD is synonymous to IPF, which is not. If you have that misconception, it is wrong. It is not. It is not similar. It's not synonymous. Okay, so I'll just end the poll, and I'm happy that yeah, many other candidates have answered it correct. Now, my question is why not option B? Can I have the answer? Smoking history, okay. Dry cough favors ILD, okay. And this is another problem, okay. Cough upper zone, okay. This is the place where people struggle. This is what I'm saying. Why not B? Why not D? Let me tell you, B, C, D all belong to one category, a big category, which is ILD, interstitial lung disease. So oh, both of them belong, all the three. So if your brain says this is ILD, you should be confused between B, C, and D. And there is a question about COP also, by the way, in the exam, cryptogenic organizing pneumonia. Can I have the answer? I'm still looking for the exact answer. Why not COP? Why not NSIP? Good, Dr. Pooja. I just got the answer. Great. Perfect. This is one clincher, one answer which just gives you the correct one. Great. Perfect, Dr. Pooja. I'm happy. Okay, great. Dr. Pooja, have you joined the recent batch? I believe you have joined the next ongoing batch. Are you the same? I'm so sorry to ask, but yeah, your name seems to be. Okay, you have joined. You have joined the. Okay, great. Perfect. Perfect. And you were there in the part one also, I believe. Yes. So you are the same. Great. Perfect. Now, when I talk about this whole scenario, many of you might have wasted time and seeing this investigation chart, might have read this. Obviously, the scenario is somewhat needed, right? I'll not fully rub it. There is a smoking history and all. But one thing which you should make sure is with the CT. This CT scan is, by the way, what we call it as is the just like a honeycomb, just like a honeycomb, right? So you can just see this honeycombing pattern which is being seen, right? So can you see this, those smaller walls and just like a honeycomb? Can you see, all of you? Can you see, recognize this is a honeycomb? By the way, this is a honeycomb pattern, right? This is a honeycomb pattern. So honeycombing pattern. And when you have saturation on a lower side and the very typical history of progressive exertional breathlessness and persistent dry cough, this goes towards ILD, but ILD have different types, has been classified. And when I talk about the types of ILDs, obviously you have granulomatous disease, you have drug induced, you have the exposure induced, you have the connective tissue disorders, and the idiopathic. Under idiopathic, what you have is IPF or UIP. So that is one type. The another one is NSIP. Another one is COP. And then is a D-squamatic also, by the way. Right? So these are the types. And if you are unaware, by the way, this stem actually are and find bibasal and crackle. This is a very typical, this is a triad, right? When I say about ILD, there's a triad of patient presenting with the exertional dyspnea, dry cough, and end inspiratory crackle. This is a triad of ILD. Now, with that, these options should be there in your mind. Now, how to differentiate? This is what I'm saying. This is one clincher, one answer is the IPF or the UIP has honeycombing, whereas these two have your ground glassing opacity, GGO. Right. So this is the pattern. I'll just show. This is the one, right? So where you have the GGO. So GGO is this one, right? So I just discussed, right, that there is one more photo of honeycombing, and so I just added this one because I discussed these things in much detail. All those who are from my previous batch, they might have seen the videos, might have gone through the videos, understanding what is the ground glassing means, what is honeycombing means. Unless you don't know it, you'll not be able to find it. So whatever these areas, right, it is just like a ground glass. So that a glass which is broken on the ground, it just looks like that. Honeycombing is a like a comb, right? Honeycomb, which you everyone knows, right, about the honeybees. So that has something this kind of a pattern. So this, if I say ground glass and glassing, yes, COP or NSIP, and this is, by the way, honeycombing. Yeah, this is me. Why I added this picture is because yes, I am looking smart. I think so. And don't you think so? I just added this picture all because of the same reason. I'm just joking, by the way. Uh, I added just to let you know that this is what we discussed in the session and which came in the exam. And after the exam, whenever the question is difficult, I get those feedback that this is the one which we just saw the image and we just answered it, right? And many of the others struggled. So this is what the honeycombing is, right? This is what the honeycombing is, as I've already marked with the green pen, right? So honeycombing pattern is being seen now. See this one. See this one. Can you appreciate? Can you appreciate this hole, the blue one, which I just mentioned, this hole, I'll just rub, right? Where in that black, you have a grayish zone. I'll just rub it. And now you just see again. Blackish is the air in the lungs, in the CT, right? Obviously, that is a air. When you have this grayishness, right? That is called as a GGO, ground glass opacity, which is very typical of cryptogenic organizing pneumonia, where patient definitely, when I say co-op, patient definitely will have a history of a fever also, right? And the other is NSIP. This is what we have discussed. Plus, there is something called a sparing. Sparing. So which one is being spared? And this is the one. This is the one which we discussed, by the way, about NSIP, DIP, cryptogenic, IPF, right? So until you're not aware you will keep making mistakes in the exam, right? So this is very, very, very important from the exam, whether it is part one, whether it is part two, you have to know the part. And in the part two, fortunately, you have to know the CT, right? In part one, yes, you can just know about the theory. You need to know, memorize the features which is being seen on the CT. In part two, now you need to recognize which is a honeycombing and which is a ground glassing. And there were two questions from the same topic from ILD, and yes, images were added. CT scans I'm talking about, right? So the other thing about IPF is definitely there's a male smoker, there's a honeycombing. And how I always discuss, anyone who is from my batch who knows the mnemonic which I always share about NSIP and COP. Anyone? Uh, Okay, sip in a cup. Good, Dr. I think now Mirabel is Samira. Is it Samira? Are you Dr. Samira? I can't see. Oh wow. I diagnosed with your other name, right? You have written as Mirabel, but yeah, I just diagnosed. Okay, great. So anyhow, so thank you so much. Now, as she rightly mentioned, sip in a cup, right? So sip. So when I say sip, NSIP, remember glass. You always take a sip from a glass. And the another one is a cop. Everyone knows about a cop, right? So cop. And if that glass is filled with something different, if it is filled with something different, I believe you are able to understand, right? So again, it's a glass, and cop will catch. So remember, ground glassing is seen in NSIP, DIP, and cryptogenic organizing pneumonia. And honeycombing is the one which is present in IPF or UIP. IPF, do not think IPF is similar to ILD, not at all. If that is a misconception you have, please change it. I have seen many doctors having that misconception. Please do not. May I have received the recording? Dr. C, I'm not sure, but yeah, I'll talk with the team to share the recording over the email. I'm not sure. I'm not particularly sure. But yeah, I totally understand your situation. It's okay. It's okay. Okay. So this is about IPF, NSIP, and the others also, right? We need to know what about hypersensitivity, pneumonitis, sarcoidosis, and right now we are not going into too much of theory. Obviously, I'll discuss this whole, spending around 15-30 minutes on this whole pattern, how the CT looks like, how to differentiate. This is what I'm saying, that how to differentiate, it matters, right? Plus the lobes, it is subpleural, right? Whereas when I say subpleural sparing, the other options become the answer. Some of the time they just use a word, subpleural honeycombing. That's it. But if it is spared, the other options are the answer. And it has a poor prognosis. And when it is a poor prognosis, you just need to go with antifibrotics, which I've already written as pirfenidone and nintedanib. I believe everyone knows. The others, we can just go with steroids. And very good response with the steroids is COP also, right? So NSIP, DIP, and the COP, they respond to steroids. But IPF, UIP doesn't. So again, my thing should is always understand how to differentiate. If you're not able to differentiate the similar looking pathologies or those kind of images, then it becomes difficult in the exam. And as I mentioned, there were two questions of ILD itself, and that is why I took this one. Now, coming on to the next one, just read the question, just read the stem, and let me know the answer. I'll show the options in the next slide once we have finished reading this whole stem. Take your time, and I'll just show the next. I've given the poll also, by the way. Question again, please. Okay, I'll just give you the question again. It needs some calculation. It needs your mathematics brain. It needs your calculator brain, right? but a very simple one, not that difficult. Weak in maths, sir. I know, Dr. Sindhuja, we all, right, majority doctors, because we have left mathematics years back, right? And then somehow we struggle, but it's not that difficult. Just read it. It's not mathematics. It's just a simple calculation, simple awareness. Just try. Don't just raise your hand by seeing the numbers. Oh, I can't do the calculation. Okay, perfect. Dr. Samira answered as 8. Unable to see the options. Okay, Dr. Mansi, sorry, now you can see the options. 6, 7, 8, 9, 10. So whatever unit you know, you are able to just write in the chat box now, right? Or on the poll, you have the poll in front of you. And just finish poll, by the way. You can just write in the chat box. Okay, 8, 8, 7. Okay, great. Guessing. Okay, 7, 8. Okay, great. Perfect. I picked C. That's your favorite option now. Wow, Dr. Shoaib. Yeah, I always say that. Yeah. So by just guessing, by the way, Dr. Shoaib, your answer is correct. It is 8 unit itself. So great. Perfect. So I always say, right, these are the few things which I somehow keep saying about is if you are unsure, go with B or C. But again, at your own risk, right? At your own risk if you are not able to. But whenever you are unsure about a question and that option, A option looks interesting, it looks shiny, please give it another 2 4 seconds to see other options also, right? Okay. Now when I talk about this, definitely, Dr. Samira, yeah, definitely you will. 24-year-old woman with type 1 diabetes on basal bolus insulin. First of all, we need to know what is basal bolus, right? I'll not go much in theory at this moment, right? We'll just go ahead with the webinar, right? So basal is to have a maintenance throughout, right? So basal is what we start, and bolus dosage or insulin we always give as a rapid acting drugs or insulin so as to maintain, right, as a pre-meal. So basal bolus combination we use has an insulin to carbohydrate ratio of 1 unit of rapid acting insulin for every 10 gram of carbohydrate and a correction factor of 1 unit for every 2.5 millimole increase in the blood glucose after about above her target. She is about to eat a meal containing 60 grams of carbohydrate. So when I say 60 grams, and over here they have mentioned as 10 gram of carbohydrate, how much is required? How much insulin is required for that 60 meal she's about to eat? How much? Just answer this one first of all. For everyone, I'm asking everyone. Everyone, I just need that answer, please. Otherwise, I can just also skip. I can just tell you the answer that, okay, option C looks very interesting, very shiny. 8 is my best number. My birthday is on 4. 4 into 2, 8. I can just explain and that I can move on. It's not about that, right? It's about the concept. You should know it, how to do it. Okay, good, great. I'm happy to see all those responses. Perfect. Now, 60 grams is there in the meal, and obviously you have to neutralize it. And when they have already given for every 10 gram, 1 unit is required. So for the 60 gram, how many units are required? 6 units first of all. Further, what they have said is her pre-meal capillary blood glucose is 12.5 millimoles and her target pre-meal glucose is 12.5. So she's way above the target. Target is 7.5, but her pre-meal glucose is 12.5. How much is the difference? How much is the difference? 12.5 minus 7.5 comes out to be 5, right? So 5 millimoles is the difference. When they say 5 millimoles, and for every 1 unit, 2.5 is provided in the stem itself. So hence, how much is there is you just add 2 units over here as well, so that it comes to the target range. Now I'll again explain in a simplified manner. What you have to do is a person who is about to eat meal right now, let's say patient is about to eat meal at 8:30 p.m. or 9 p.m., right? Pre-meal sugar. when you test, it comes out to be 12.5. What you want is 7.5. So first of all, his or her, right now her pre-meal is way above the target line. It is 12.5. You need to bring it to the target range. So 12.5 minus 7.5 comes out to be 5 millimoles. This is the difference. And 1 unit takes care about the 2.5 millimoles, right? So you just give 2 units over here. And plus, in the meal, this lady, this woman is about to eat 60 gram of carbohydrate. Now you need to neutralize that also. So 60 grams, because you have already on the target range, 60 grams is neutralized by how much? I mean, a 10 gram is neutralized by 1 unit. For 60 grams, it will be 6 units. So in totality, the answer is 6 plus 2, which comes out to be, can I have the total answer now in the chat box, please? The simple calculation, Dr. Sindhuja. 6 plus 2. Okay, great. I'm happy. So this is how to approach. It's not that difficult, but in the exam, people are like, "Oh, what has happened to us?" It's a bomb thrown us, right, thrown at us. It's not a bomb. It's not. It's a simple thing. It's a simple thing, and that somehow creates pressure. And this is another slide where again, I can't say I'm looking pretty smart over here, right? It's a very odd posture, but yeah, I was explaining the similar question in one of my Q&A session, right? Similar question about the calculation. And similarly, in the similar aspect, this question was asked in the recent diet. So I'm just giving you that unless you have not practiced, unless you have not seen these questions, or the way you come along with the answer, it becomes very stressful in the exam. And when you actually, and after the exam, again, this was another question I got as a feedback, sir. It was almost the similar question which you discussed in your Q&A. And that is what matters, that when you feel, okay, this can be asked in the exam, or this have been asked in the exam, and you are practicing, you feel confident approaching it. Okay. Now, next one. Just read, yeah. Dr. S, yeah. Yeah, it was an easy one, yeah. The previous one. Now just read this one. Take your time, and then I'll show the options also, by the way. Okay, see the options now. So what I'm discussing right now are the questions asked in the exam, right? And I want all of you to understand how to approach, and again, how about the other options, how to interpret these values. Yeah, great, perfect, I'm happy, great, perfect, 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 great. B. So it was primary ovarian insufficiency. Great, perfect. Now when I go back and see these values, do not, whenever you have the values in front of yourself, do not get stressed. Rather, feel confident that, okay, I know how to interpret the values. When I say LH is high, 32, FSH is also high, estradiol is definitely low. Total testosterone is in the range. Normal SHBG, which is the sex hormone binding globulin, which is again in the normal range. Prolactin is somewhat lower side. TSH is in the range. Now, this patient presented, once you have seen this, right? Once you have seen this, go with the stem. This should be the approach always, which they say a 34-year-old woman present with 10 months of amenorrhea. So there is the patient presented with amenorrhea. Now your mind should go towards a table of amenorrhea, that how can rule out the options, and how I can come up with the answer. So the presenting complaint over here is amenorrhea, right? She has been trying to conceive for the past 1 year, BMI and all those things, right? So all those unnecessary stuff is provided. But yeah, that also makes sense, right? No hirsutism and acne. So they are trying to rule out the other options, by the way. Now, with this, when you're with these three investigations itself, you'll be able to answer. So from the master, right? Master is our pituitary. Above the master, there is another one, right? What do you say? That master is, let's say, your HOD, right? Or your head of department, or you can say the consultant or whatever, right? That is a master gland pituitary. Above the pituitary, we have someone who is controlling everything. The answer would be right now the hot topic, not the hypothalamus, the politicians. Again, I'm just joking. So I'm just quoting the fact which is going on, the hot topic at the moment, right? So it is hypothalamus. So from hypothalamus, what is released is GnRH, right? So gonadotropin releasing hormone, and that is an input given to the pituitary. Now release the sex hormones which are LH or FSH. Now this goes and stimulates the sex hormone, the organs, which is the ovary or the testis. So this is the concept. Now, when they say this one is elevated, LHFSH is elevated, and ovary, so from as this is a female, so ovary is low. So where is the problem? There is a problem below it, right? Below it, at the level of ovary itself. That means estradiol is not being released, although LHFSH was there. And now, when the ovary is not functioning, the LHFSH keeps increasing. Why? Because there's a stimulus coming up from the hypothalamus, GnRH. Please release LHFSH. We need that. But what is not responding are the ovaries. So it's a ovary failure. That's it. Primary ovarian failure. That's it. And this is how, I mean, this becomes easy when you have those interpretation. When you have these, sorry, I forgot to add the table, by the way, which we discussed. So there's a table I always discuss about, and this is how it is. This is the concept, right? And you need to know what happens in PCOS. You need to know about a primary ovarian failure. When I talk about the other options, let's say hypothalamic amenorrhea, what will happen in hypothalamic amenorrhea? So when I say hypothalamic, LH, FSH will be low and estradiol will also be low. That's it, right? In a case of PCOS, what will happen in a PCOS? I'm not getting the answer. Should we go to the next one? Okay, testosterone is high. Perfect. Okay. And what about okay, great. High testosterone. Hirsutism again. Good. And this is what I mentioned is this is not just as a distractor. This is just to rule out the other option, right? So great. Perfect. And hence you can see, obviously, this is not a hyperprolactinemia. Prolactin is not that high. In fact, prolactin is, I mean, this is the weirdest option provided. Weirdest. It should not belong to this question, by the way. And obviously there's not pregnancy. So you need to know how to rule out, plus not just the rule out, you have to have an approach, right? Whenever the question is there, you need to have the approach. Okay, this is the, I believe, last or second last, I'm not sure. Can I have the answers, please? I'll just show the slides also, by the way. Kindly, yeah, these are the options. Kindly write in the chat box, please. Kindly write in the chat box, please. Yeah, I can see the answers now. Okay, great. Perfect. Not sure. B question mark, C question mark, B question mark, C question mark. You have to give fluids. Okay. Dr. Priya. Okay, you have to give fluids. Okay, C, A. Okay. Okay. Again, I'll just give you time. Read the question again and just ask you to read the question again. I've already seen the options. Can I have the answers now, please? Okay. C. Okay, now. Sorry, I was a bit occupied with some of the responses and some of the messages. Yeah. Let me just my window. Wait a second. Yeah. Okay, so this question says a 59-year-old man with inferior STEMI treated with PCI remains hypotensive and bradycardic. 12 hours later, despite fluid resuscitation, whosoever answered fluid. You just love giving fluids to the patient. You just keep saying, okay, just keep taking fluids. So the question itself has mentioned despite fluid resuscitation. So you have resuscitated fully with the fluids. There is no point of adding more fluids to this kind of a patient. His JVP is elevated, but now the important line is lungs are clear. So when I say lungs are clear, that tells me what? What do you conclude? What do you conclude? Lungs are. Acha, can you show the options again? Okay. So high CVP, but lungs are clear. So CVP, the JVP means over here, right? The JVP is elevated. Now, when you have your heart, right? How I always discuss is the central line, right, which is coming over here from the internal jugular or subclavian, whatever it is, and going to the right side of the heart, which is in the right atrium. And over here you have the JVP or a CVP, right, which is elevated definitely. Now the elevation of this JVP or a CVP can be because of failure in this part or maybe failure in the blue part. The purple is obviously the right-sided heart failure, or the blue one is a left-sided heart failure. So with one line itself, which says lungs are clear, what I have ruled out is it's not a left heart failure. It is the right heart failure. Are you able to understand that with just one thing? It's a right heart failure, right? Yeah, so it's a right heart failure, right? So it's not the blue one. Left, had it been the left-sided heart failure, lungs would have been flooded with water. They would have given in the stem that they have basal crepitations. They have crepitation all over the lungs. The lung fields are flooded or having a plethoric. These are the words used, right? Or in the imaging, they can just give you the image, the X-ray of pulmonary edema. So when I say pulmonary edema, that means yes, there is back pressure. So the left side heart is not functioning, and hence the lung is flooded, is congested with the fluids. So this is X-ray. If they say X-ray is normal, is clear, that means this is not a problem of left side heart failure. This is definitely a problem of right side heart failure. And when I say right side heart failure, the first thing to be done is always fluid. So you are right. Whosoever has mentioned as fluid, you are right in saying fluid. Whenever we say right-sided heart failure and lungs are clear, give fluid, start with fluid. And this was the question asked in the recent diet. And this is also I discussed in my previous Q&A, right? Why I'm saying so is when you get these kind of a question and you have a clear idea, you have a crystal clear idea what is being asked, what is to be answered, you are relaxed, your brain is relaxed, right? So what I would just say is, when it is a right side heart failure, the first step is fluids. But this question, this was asked in the, not the recent one, the previous diet, right? It was asked, right? All those who were in my previous class, they know we discussed that in detail. So despite fluid resuscitation, so you have already the doctor on duty, whosoever the smart doctor is, he or she has already resuscitated the patient with the fluid. So that is being taken care of. Had it been the scenario like in this exam, what they asked is almost similar scenario. The patient was not bradycardic, by the way. They have given the only scenario given was JVP was raised and X-ray was normal. This was written, right? By the way. And they asked, what is the next step you will do for the management? Answer was saline. All those who have written the exam didn't know it. This was asked. So it is crystal clear, right? You know what is happening, right? With just X-ray giving normal. Now, in this one, which was asked in the previous diet, fluid resuscitation has been done. The first step is fluid. Whenever right side heart failure, fluid is to be given first. Next, once you see what is the scenario being provided, they say patient is bradycardic and hypotensive. Once it is bradycardic, and if let's say heart rate is, although they have not given in the stem, nowadays they are giving very less uh, detail in the stem, by the way, the RCP. So if patient is hypotensive and bradycardic, you always, as a next step, as a management, so as to save the patient, is temporary pacing. That's it. That's it. And you save the patient. So this is the way, right? So you have to have a clinical reasoning. You have to have that logical reasoning. What will you do, right? As a doctor who is standing over there, who's managing the patient. And nowadays they're asking these kind of questions, which are very much relevant in your clinical practice when you are managing a patient in your emergency, in your ward. So definitely it is important, right? What would be the answer if the lungs were unclear, because I heard that right or not? Exactly. So now Dr. Su has asked this question. Can I have with the same option? What is the answer? If it is I also wanted to ask the same question. By the way, you took the first step, Dr. Su. Thank you. Now, what will be the answer if I say there is crepitation? Right? I'll just add one line. I'll remove X-ray is normal. I'll remove that. I'll just say there were crepitation while auscultating on the lungs. That's it. Or I will just give a image X-ray of a pulmonary edema. Now, what would be the answer? Exactly. Perfect. So when patient is going into this scenario, you have to go with IABP as to prevent that kind of a scenario. Patient is deteriorating at the moment, right? So decompensated or deteriorating at the moment. So you have to have IABP. IABP is always used for left ventricular failure. So when there is LVF and there is left ventricle which is failed and you have the fluid in the lungs, IABP is just a bypass so that you can take the patient into the operation theater, right? It is not the intervention of choice, it is the next best step. Why? What IABP actually does, it improves the diastolic pressure. How come? By that, by inflation and deflation of the balloon. Again, I'll not go into much of a detail. Definitely, I talk these things in a further detail when we are going with whole, let's say, a shock management, right? So these are the points which you need to know how to manage shock actually. And nowadays, what I was talking about is nowadays they are preferring these kind of questions. There are many questions about emergency management, how you deal with these patients. What about your logical reasoning? When you are as a doctor working in the NHS, standing over there in a A&E, how will you manage these patients? That is important, right? And this is what they are asking nowadays. So you have to know the pattern. So past two diets, I've seen that pattern again. And every time they have a pattern, they keep following that pattern. So by the way, yeah, great, Dr. Samira also. Yeah. So that's IABP. So that this is just a scenario you need to know, right? How to manage. And if I just remove bradycardic, if it is hypotensive only, you have given inotropic agents to, you have given fluids to this patient. Next step would be the inotropes. if I remove bradycardic, right? And when I say anatropes, the best one, obviously, you go ahead with is a NORAD, right? Noradrenaline. And whenever the ejection fraction is on lower side, then you go with dobutamine. Dobutamine is the answer, right? So this is how it is. So anyhow, so great, perfect. I'm happy. And now coming back, so we have discussed about the difficult and the important and the tricky questions which were asked in the exam. And this is what I'm saying, that you need to know the pattern. You need to know what are the questions being asked and how to approach, how to have a whole scenario in front of yourself. Now, when I say how to manage, right? So don't see these months, right? Again, it depends upon a person to person. What I always say is, first of all, understand the basics and the advanced of a particular topic and have those concepts, have those understanding. When I talk about shock, you need to know what are the different types of shock. There are four types of shock, by the way, right? I believe many of you already know it: hypovolemic and cardiogenic and obstructive. So I think everyone knows about all those, right? And then the last one is distributive. What comes in distributive, by the way? I'm just if you love it, right? I can just keep going on a discussion in these things. What about distributive? Yeah. Great, Dr. Samira. You are actually picking up the important points, the exact points. I'm happy. I'm happy. Have you watched the cardio video of part two? Because you have already enrolled, Dr. Samira. Have you watched that? Oh, oh, you have already watched. Okay, perfect. So you have finished cardio, Dr. Samira. The theory which you might have got. Perfect. I can see that precision. I can see the precision in your answer. I'm happy to see your precision. How precisely you are answering. I'm happy. I'm happy, Dr. Samira. Good going. So this is the way. This is the way, right? I mean, you need to know what is, and she just cleared her exam 3 months back itself. I mean, the part one I'm talking about, and now she's preparing for part two. And yeah, and now I got the answer. Again, I came on the diagnosis that you are answering with a precise thing. So you have already watched the recording of part two. Great, perfect. So what I'm saying is mastering basics to advanced high yield concept first of all, then having the PYQ mastery. You need to have understanding of the previous year questions discussions, right? So you need to have what are the previous year questions, and not just the question, the topics, which in our batch, Dr. Arshia is there. So she takes an excellent session regarding how the questions are being asked. It's a live session, by the way, right? And how to approach them. The main thing is not the question, it is about the approach, how you rule out the option and what can be the plus and minus from that particular topic. If I talk about this time, there's a question about a macroprolactinemia, right? I believe whosoever has given the exam, they know it. Macroprolactinemia, how to manage? The answer is very simple. It's cabergoline. Everyone knows, right? In a macro, but how to come onto that diagnosis? And when I say macroprolactinemia, how it looks in a MRI, where to look for, what is prolactin, where is the area of a pituitary, what about the craniopharyngioma, which one is the one, right, which compresses optic chiasma. So when you have this kind of understanding, you know, because in one of the previous diet, the question was asked from craniopharyngioma MRI finding. So you need to know how a pituitary tumor looks like on a MRI, about a prolactinoma or something like that. And what about a craniopharyngioma, how it looks like. So unless you are not aware of that imaging, unless you don't know about how to differentiate, what about the eye thing, eye symptom in both of them, obviously that defeats the purpose, right? So I always say, when you talk about the PYQ, it is not the question. Do not just have a mindset that, okay, I'll just see this question and I'll try to answer, I'll try to search in the exam. It will not repeat. Questions are not repeated, right? Take that as written, right? They are not repeated. The repeated things are the topics, and for that topic you have to have a great understanding. So when the question as this time is prolactinoma, I'm very much sure in the next diet, they next, or maybe the next one, they will again give image. This time there was no image of prolactinoma. And if you're not sure how it looks like on image, again, so that defeats the purpose, right? So on MRI I'm talking about. So MRI findings were there very there were 3-4 MRIs in the recent diet, right? MRI brain I'm talking about, brain and spine. Then is having the structure, which I already have discussed, that you have to go with time blocks, right? So you have to have a time mock exams or timed practice sessions so that you can time yourself. And then yeah, mock exam plus keep practicing the questions on a daily basis. That is again important structure. And when I talk about how I help or how we help as a team, for part two, we have Dr. Arshia, as I mentioned, she'll also join in a while. Dr. Hani is also there, right? So we are there to help you with all those structures, all those things. Yeah, I can see Dr. Arshia is there. Dr. Hani is also there and driving a car. So great. So Dr. Hani, yeah, concentrate at the front, right? So yeah, I'm happy you are there. So what we do is we help you understand, first of all, the topic, right? There are theory modules, theory recordings, new ones, right, which are the updated ones, so that you have an understanding of a concept of that topic, right, from the very basic. Let's say we talk about the neurology. It starts from how the CT looks like, right? How to differentiate CT from MRI. That is a very basic thing, right? And somehow people and doctors struggle how to differentiate CT from MRI. And now once you know it, how to differentiate MRI different sequence, T1, T2, flare, DWI, ADC. And all of it is important. I can't say, okay, pick flare, pick T2, pick DWI. No, you need to know how it looks like, how they differs, and how it looks like on a, it should be there on a brain abscess or a glioblastoma, or let's say toxoplasmosis or lymphoma. You need to know each one of those findings. You need to know how to look for, right? So that is again, that is the theory videos. Plus we have, again, we need to know the exam questions. You need to know how it is being asked, how are the questions, plus not just the question, the topic, how to understand that, right? Plus we always take care about the latest NICE guidelines I was talking about, and not just the NICE guidelines, how the questions can be framed and can be asked in the exam, because until unless you have not practiced those questions, it again doesn't make sense. Because nowadays what I've seen as a pattern is they have changed the pattern and they are asking updates, they are asking the new things. And yeah, mainly obviously the NICE guidelines. Plus you have the weekly mock. Until unless you don't practice, you don't assess, you don't keep practicing those every week, your brain is not trained. You are just going in a random manner, just doing your random stuff at your household and just going with the questions. No, you have to have one week, once a week, you have to sit down, take out time, just like an actual examination, just simulate the exam scenarios and the situation, and then see how you are performing. Again, it's not just a score, I would just say, always say, is a number, but think and assess why have you made errors and how you can improve, because it's not about just finding a problem and then solution to it. That is very important. So the more you actually go with these live mock exam where people are there in the batches and you see others performing, you see others score, and you are like, okay, I also need to improve, right? I also need to study. If you are taking out 2 hours on a daily basis, no, that is not sufficient. If you are taking 3 hours, still not. 4 hours, still not. Five, do not increase the number. Now there is a problem with your concentration. You are being distracted. So it's not about 5 hours, 6 hours, 8 hours, 10 hours. No, you are being distracted and you are not concentrating on what the facts which is to be known. Right. So that actually helps you. And we are always there, Dr. Arshia, Dr. Hani, they all are there. Plus the another one is interactive WhatsApp mentorship, right? So, and this is what happens, right? Dr. Hani is there, who just keep discussing many things, and many questions were asked, by the way, right? We got feedbacks also that many questions were there from our WhatsApp group. We have a discussion on a daily basis on a particular question, on a clinical reasoning, not just a question but a reasoning, why this particular option is the correct one, why not, and what about that whole topic, right? So that is what matters, because you need to be in that sound environment. And it's not about this WhatsApp group which I'm talking about. It's not about happy birthday wishes or a happy new year wishes. It is just about MRCP discussion only. That's it. Because you need to be surrounded with that environment. You have to have peers, you have to have your colleagues around you who are also preparing. That motivates you. Otherwise, somehow we feel lonely. We feel, okay, we are lonely in this journey. One or the other time you have gone with endocrine, the other time pulmonology, and then you're again having that question mark, that dilemma or self-doubt. Should I register or should I not register? And starting with those questions, right? So this is how I always say. And we are starting our next batch on 16, by the way, right? where we have the live sessions. And these live sessions, by the way, are Saturday and Sunday. I'll just show it to you, the schedule for the batch, right? And this is how we go ahead with 9 or 10 weeks, right? And we have these main units, plus there are revision week in between. We have the mini mock, so that plus this revision week, by the way, is to cover the backlog and revision, right? So once you have a proper schedule in front of yourself, that okay, this is my schedule, this is how I will go ahead. If let's say you start with neurology and not able to cover that in the next week, or maybe in this week, where this week is particularly kept as a revision week, not do not replace, I keep requesting, do not replace this with a Netflix week. This is not a Netflix week or relaxation week. This is a revision week or a covering your backlog, right? Because you have to train your mind, okay, I'll just go ahead with this thing, right? And then you have these units done. Again, there's a week to cover your backlog, and then there's a mini mock, right? So mini mock 1, mini mock 2, so that you are again going with those a mock exam where random question from, let's say, neuro coming, cardio coming, pulmo coming, gastro coming, because in a particular week you are somewhat, your vision is narrowed, right? You know, okay, this is a question about endocrine, answer would be relating to endocrine, can't be nephrology, है. But once you have a mixture of it, which happens in the exam, so you have to have that. And the last, we have the grand mock, which is on 8th, and then we have the rapid revision the last few days, 10 to 23rd. And the most important is, which I have written in the green, obviously it is always a green thing and it should be a green signal, is a part 2 examination, right? So you have to crack your exam on 25th of November. So that should be your whole thing. And when I talk about a particular week, this is a whole overview of a 3-month course which we are starting on 16th of August, by the way. So when we talk about a particular week, further zooming in, right, going into it, is you get a theory recording, right? As soon as, by the way, you enroll, right, you start your preparation, you enroll, you get a neuro and cardio theory module, right? And questions also, by the way, right? So we have questions in our application which are almost similar. Dr. Arshia has created, and they have gone through many things, many questions, and which are similar, and the questions which have been asked in the recent diets, not 5 years, 6 years back, recent diet. So they are there in the Q bank, which we have in Intellect Medicos. So what you have to do is go with the theory recording, then practice the whole week. So Monday you are getting a theory recording, the whole week you have to practice questions. And in our Intellect Medicos, we have 150 questions from each specialty. Neurology 150, cardio 150, pulmo. So every specialty has 150 questions, right? Not 600, not 700, because that becomes overwhelming. I totally understand when you are doing a job, you are having a hectic schedule, you have your on calls, you have your busy, and you have much responsibilities on your shoulder. Obviously, it becomes difficult to go ahead with 500, 600 questions from a specialty. Then yes, 150, the high yield questions which have been asked from the previous has been asked in the previous diet, right? And a tricky ones, not the simple one that okay, you know the answer, it is atrial fibrillation and bisoprolol is the answer. Not at all. They are the tricky ones, so that you know how to handle those tricky ones, how to approach those tricky ones, right? So once you have gone with those practice modules, on Saturday we have a live PYQ session, which is a previous year question discussion, that is on Saturdays, right? And when we talk about the live, if let's say you are not able to come live or attend live because of your responsibilities or you maybe your duty, then yes, you can watch once the session is has ended. The recording is uploaded on an application after around 2 to 3 hours or 3, 4 hours, right? So you can watch the recording later on. And then the last day of the week, on Sundays, we have a mock exam of that particular week, followed by a live discussion, right? Followed by a live discussion. So on both these days, it's in the evening time, 7 or 8 p.m. IST, or you can say the UK time is 3:30 p.m. UK time, right? It starts from 3:30 p.m. UK time and it goes to 4 or 5 hour session, right? When we talk about it. But again, you can go with the recording if your time doesn't match or it's not that flexible, right? Depending upon your responsibilities. So this is again a pattern thing which somehow gives you that insight. Okay, I have to do it. Why? Because others are doing it. And secondly, and the mainly is, it's your dream, it's your goal, right? Because until you don't have that push, until you don't have that kind of thing, then yeah, you will not get that idea that how to do it or why to do it. Somehow we are lost with that why also, right? Some other time we feel okay, we have lost it, right? So I'll just although some other times I keep getting those messages on my WhatsApp, on my Instagram also, by the way, that how it should be, how is the schedule, and I've already shared the schedule. I'll just give you an overview about how the uh, our application looks like, or the modules look like, right? So that you have an idea that this is the way you have to go ahead. Wait a second, I'll just share the screen. uh, Wait a minute, just share my screen so that you have a clear idea how we go ahead discussing those things. Where is that gone? Okay, yeah, over here. I can see that. Wait a second, I will just open it. Yeah, there it is. I think now you are able to see the screen. Are you able to see the screen, by the way? Are you able to see the screen? Can I have in the chat box? Okay, great, great, great. Yeah. So when I talk about this one, let's say we start our batch, and this is how it is. It looks like, right? So enrollments, and yeah, I'll just go ahead with this batch and orientation session where you can see the smart faces. Dr. Hani is also there. So yeah, so that's the orientation session. And then we have the neurology. Let's say if I talk about the neurology, I've subdivided into smaller modules talking about the basics, the CT, MRI, neuroanatomy, right? So, and then you have the lobe lesion, ischemic stroke, hemorrhagic stroke, spinal cord lesion. And many of the candidates, they struggle with the spinal cord lesion, how to differentiate. So PNS, neuromuscular, muscular disorder. So this is the way, right, it is being provided. And this is, let's say, I'll just give you a look with the neurology PDF so that you understand, okay, this is how it is. This is how the way I explain the things, right? So that you start from the very basic, you understand how about the CT, right? What are these pathologies? What about the gray matter, sulci and gyri? So that you have an understanding. And then about the lobes, where is the pathology? Because I do not believe that it just keep preparing for the exam. Yes, exam is a short-term goal, but at the end, why are you preparing this for going for this MRCP? Is to be a good physician. You can't just say if a patient presents to you with a CT or MRI and you're like, oh, I don't know much. I skipped it for my MRCP prep, and I'll just ask a neurology consultant or neurology fellow to be there, right? So you have to have an understanding, right, about the CT, how it looks like, how what are the diseases, what are the pathologies, and yeah. So this is a plus the spinal images, and nowadays there are many things, many questions being asked from the spinal images. So you need to know how to interpret those spinal cord lesions as well. So this is just a brief one, right, about a neurology PDF. Uh, Wait a second. And we have the Q&A, which Dr. Arshia takes about, right? So, and there are the neuro mock also. I'll just show one another thing which people keep asking. Yeah, this is the one neuro practice module, right? So let's say this is the question. Oh, first question is wrongly answered. But yeah, see why I am just giving you, let's say this is the answer option selected, right? And see the timer. This is important, right? Again, so if I go to the next one, right, and I select any other thing, and if I submit it, so you can see the answer. You can see your timer, by the way, right? I'll just submit, by the way, submit, and you can see your timer, that how much have you time and how much have you scored. So that is about a practice modules. Plus, you see the explanations also. You see the explanation. I'll just open another one. Let's say you see the explanation which are given in the high yield points, why the other options are not the correct, which is again important. I don't know, this is wait a minute, because of the screen mirroring, my application somehow doesn't work because it doesn't allow screen mirroring. It doesn't allow you to have those screenshots, by the way, right? So it doesn't allow. So yeah, so I think that's the issue. Yeah. Neurology, and when I talk about the neuro module, I was talking about the practice module. Yeah. So if we yeah, what I was about to show is, let's say I select any other option and verify answer, right? And see the explanation also. So you have not a lengthy one, you don't have that, okay, I have to read whole of it, but at least why the other options are not the correct one, right? So this is always I feel that should be the scenario, right? So explanation, again, when we see the explanation, this is the way it's said, that why the option A, B, and other ones are incorrect, why this one is the correct one, so that you have an answer in front of yourself. Okay, so this is just an overview, I would just say, about the application. I'll just exit this quiz, and yeah. Would it be a replacement for other Q banks, Dr. Su? Yes, the answer is yes. You don't need to go with other Q bank. If you have time, you can. So these are the units. Then we have a 4 unit, by the way. Once we cover 4 unit, I always go with a discussion, right? A PYQ discussion or a discussion. Once 4 unit are done, so we revise. We have the revision sessions also, right? Plus we have the flashcard. There are new flashcards being made for part 2 also, by the way. So anyhow, so I'll just stop it over here, the screen sharing, and I'll just come on to the previous thing which we had as a slide. So I'll just come on to the page again, slide. So what I wanted to say is, you have everything material, right, which is being provided. And Intellect Medicos, you don't need to go with other resource. But yes, at the same time, if by the way, let's say you have time and you feel, okay, I can go with another question bank, which I believe is past test is the good one, because past medicine is nowadays, what I use a word is obsolete. It's not because I'm not in their team and I'm with past test. As a course director of past test also, by the way. So it's not that I'm supporting, but yes, they have good questions, right? Past medicine, not at all. The kind of question they have, that just misguides, or that just give you a false information, false confidence that you can go ahead with this exam with that confidence. But when you go into the actual exam, you feel, oh, the questions are very much different, the questions are very difficult, they are not similar looking questions. Why? Because in past medicine they are very lengthy questions, which is not the case nowadays, right? And it's not about lengthy, it's not about the length of a stem, it's about the difficulty level. It doesn't match at all, zero. I would say, please do not, because I've seen people who suffered, who have given their attempt, because it's not about just writing the exam. It is about getting that negative impact on your confidence when you get answer or written as a fail in front of your name, right? How much ever you have practiced, how much ever you have given your efforts or having that efforts put in. But what matters is obviously that if your attempt is wasted, that impacts, right? So never just write the exam for the sake of it. Rather, attempt it when you are confident, when you feel, okay, I have read it, I have understood it. Before the exams, everyone feels underconfident, right? Nobody, even when you talk about the examiner who's writing the who is selecting the question, he or she will also get somehow anxiety while sitting in the examination, that the 100 question which I sit in, will I be able to remember all 100 or 99 or 98, right? I mean, that happens. But when you are well read, when you know the CT, when you know the images, when you know the theory about a topic, you somehow have confidence. Okay, I know the theory, I have practiced the questions in the right manner which have been asked in the exam. That is what matters, right? So I would just say, this is about your exam, this is about your attempt, this is about your thing, right? So your career. And Dr. Arshia is also there, Dr. Hani is also there. We've got some people who use passment alone and pass, same with pass tests, some use too. Dr. Martins, I don't say you cannot. I'm not saying you cannot, you can. Even some other people I know who haven't used past test, past medicine, but passed. But every other person, I'm just talking in totality, right? So seriously speaking, Dr. Martin, at the same level, I mean, there are people, they are doctors, right, live examples, who have not practiced past test, past medicine, but they cleared. But you can't generalize That is one in thousands. So you can't generalize, right? So I'm just giving you a clear picture. I'm not saying that, oh, if you do pass medicine, you cannot pass. You can pass. It's about you. It is not about Q bank. It is about your understanding, that person's understanding who have passed, right? If you are learning the facts which are written, if you know what are they talking about, the theory, the explanation, then yes, that makes sense. So that is what I'm saying. So past medicine should not be preferred, sir. Yes, my clear crystal, because I am an individual who follows a clear path, a crystal clear, right? I don't like confusion. So when you have too much options, you are like confused, oh, this one or the other one, and 1 2 months are already gone with just that one single question: is it past test, past med, or BMJ, or the other Q bank? So you have to have that crystal answer. No, it is not a good one. Why? Because it is not similar. And I'm talking about the recent diets. Talk to a person, talk to a doctor who have written the exam recently, not 3 years or 4 years back. The scenario was different back then. In my 1 year back, when I was there with the pastors also, I used to say, yes, past medicine is good for part two also. But now the scenario is totally changed. Again, I'm saying, have a word with your candidate, a person who have written the exam, right? If you have not written by yourself, if you have written it, you know the answer, you know what has happened. The pattern is changed. It is not like a past medicine. Not even a single question looks like that, right? So I mean, I'm not again going into that debate of past medicine, but I'm just giving an overview as per the question. And Dr. Arshia is also there. Hi, Dr. Arshia. And she's the one who helps many candidates, and we had great feedback regarding Dr. Arshia, Dr. Hani, about how they help. And by the way, we are starting our course on cohort on 16th of August, and I've already shared my WhatsApp number. The name is Brijesh, who will help you if you wish to enroll, and I have already given discount also, the webinar discount, which is 899 in place of 999, right? So okay, yeah, Dr. Ahmed, can we use the same part one notes, or do we need to read extra or more? Dr. Ahmed, have you played games on your PS or any other games, right? In your childhood, maybe not now. So after stage one, whenever we are playing a game, stage two is always difficult, isn't it, Dr. Ahmed? Or stage two is similar to stage one. It is always difficult, Nana. So you cannot say, okay, what you read, oh, theory remains the same. I'll not say, okay, change the theory. Theory remains the same, definitely, because it's all about medicine. But your strategy, your pattern, your practicing is changed, right? You need to know, again, go into a depth of a topic. You need to go understand the images and how to rule out options. That is what I'm saying. And you need to have that pattern recognition. So this is what I was talking throughout. But yes, theory, if you're talking about just the theory notes, I would say, if you have had your effort done for part one, yes, keep it, because 60 to 70% of the theory is similar in part one and part two. Theory is almost same because it is medicine. But how you approach questions is different in part two. That is difficult. That is somewhat different from part one. Okay. I'll just okay, unmute. Okay, sorry, so sorry, Dr. Yeah, Arshia, hi, and Dr. Hani also. Sorry.
Hi, sir. Hi,
Yeah, hi.
everyone. Yes, sir. So I
Yeah,
think
what's your thing, Dr. Arshia? How the strategies which you can tell them, how they can prepare, they can strategize their preparation, because now you have held many doctors, not just with
I
exams clearing at a one go. So can you just give them your thoughts, your feedback?
yes, sir. And thank you so much for the appreciation. And to just summarize, I think you have covered everything, sir. How we should be going with part two. The first step is you have to accept that part one and part two both are different. Part two is different from part one. You have to accept this and then start learning. And the first thing is you should have good hold of concepts. Your concept should be very clear. And then comes the questions. In the questions, the topic is going to be the same, but the change comes how they are going to ask. And in the options are very close. You might feel every option is correct. At least two or three options are correct. And the findings of two or three options are being provided in the question itself. But still, you have to choose the best one. Sometimes the best answer is not in the options. So you have to choose best among the options. I hope you are getting my point. They twist the way they ask the same topic, the same concept. If you have a clear concept, then it becomes easy. You straightforward, you go and just mark your answer. Like I think Dr. Samira was answering the questions. She has seen the videos, so it's great. I don't know her personally, but when she was answering, I was also feeling very good because it's about the concept. If she's having good hold of concept, then it becomes easy. You understand where they are keeping the trap. Otherwise, you might feel like the question of aspergilloma and invasive aspergillosis. After the exam, you might feel you have marked it correct because there was a fungal ball and you have seen the halo sign and you have marked aspergilloma. No, there is something more than that. And also, I can give multiple examples where the two different conditions are mixed. Like in part one, if you see a particular line, you go with this option. Like for example, coming to the nephrology, you have the presentation is looking similar to IgA nephropathy, but the biopsy is showing something else, so your answer changes. The two conditions can still be there in a single person. Rheumatology is full of that. Like they add multiple comorbidities and the presentation is going to give you the answer again. So same comes with cardio, neuro, or whatever unit you might take. It is about the mixture of units, mixture of the comorbidities or and you have to look for the presentation, investigation, and especially what they are asking in the last line, which is again going to change your answer and the options. So it's about the practice. In part two, I would say practicing the question bank has higher weightage, higher importance than part one. In part one, many of you might have cleared by just reading the theory and going for the exam, and you have done minimal number of questions and you have cleared it. In part two, it's very difficult. It is definitely possible by few of the people. Yes, it's definitely possible, but not always. For the majority, if we generalize, I don't think you should be going without practicing the questions in part two. The same concept, the same topics, again, the twist, the answer changes. And coming to the approach and like how we strategize during the week, as sir has shown the PDF already or the slide where we'll be having a theory recorded session given to you on Monday, and then throughout the week you practice the questions. Now coming to the questions and the question bank, as he has already answered, I would say you have to give the preference first to the Intellect Medicos question bank, not because we have prepared it, but it is a mixture of multiple question banks. Like after going through multiple questions, which are there in the textbooks or the question banks, the books, or whatever material which is provided, which is present in the market for part two, the high yield questions and high yield topics have been chosen, and we have given minimal number of questions. 150 questions, I don't think will take much time for you to solve. It's not just about solving a particular question. If you solve one question, you will be learning 5 topics along with it. Why not the other options? What is given in the clue? And you should be learning everything about a particular question. It's not particular question with all the options. So you are covering almost 4 or 5 topics minimum for every question. That is the reason we have less number of questions which are high yield. I hope you are getting what I'm trying to say. After you practice the questions, then on Saturday, we'll be having the live previous year question discussion, that is from the recalls from the last diet or the last to last diet. So the recent ones within a year, like last 3 or 4 diets, the questions will discuss the questions which were very tricky or which were very difficult for the candidates who have given the exam. So you will understand after doing multiple questions in the practice module, you still have something more to learn. It's not about again the concept twisting, how they twist it and how you should apply it. Coming to Sunday, you'll be having the mock where you can assess yourself by looking at your score, and you can also solve the questions in a timely manner. Like within 1.5 hours you have to do the 50 questions and you can see your score compared to others, how is it, so that you can it's not about getting discouraged or getting demotivated, just to have an idea how others are performing and how you can perform better. After the mock, we'll be having a discussion where you can ask your questions, where you can any topic throughout the week. If you feel something was troubling you, particular topic was troubling you, you can definitely discuss on Saturday or Sunday. Again, we can go through it. And also in the WhatsApp group discussions, the best part is when you have a doubt, directly post in the WhatsApp. Either sir or me or Dr. Hani are going to answer you. If not us, your peers will help you in it. So it becomes a good interactive learning. The bare minimum which you can do is going through the WhatsApp, where you will be having multiple things, multiple questions, and multiple topics which are being discussed on everyday basis. And going back to the question bank point, yes, the Intellect Medicos question bank, the first priority. Once you are done with it and you still have time, then you can go for past test. Yes, in the past medicine, yes, the concept, the theory, yes, it looks good. If you have done it for part one, you feel like the same explanation, it becomes easy for you to read, for you to understand. But you have to understand the way they ask the questions is different from what they are giving in past medicine. That might give you pseudo confidence. If you score like 60-70% in past medicine or in past test also, it might give you the pseudo confidence that you are doing very well, but it's completely different from the actual exam. You can have a word with the people who have given the exam. You will understand the difficulty level is not either similar to past medicine or past test. So yes, I think I have completed everything, sir. The summary, like
Okay,
what?
great. Thank you so much. And the way coolly and calmly she explained the questions also, it's just like that. And people they
Thank you.
just love they just love the kind of interaction she has, and especially ruling out the option. That is the trick. That is the trick you need to learn, right? And Dr. Hani is
Thank you,
also
sir.
there, who is another favorite of our
Uh,
previous batchmates. Hi, Dr.
uh,
Hani.
Hi, can you hear me?
Yes, yes, yes. And
Yeah, I'm
I
just
believe many of you might have seen him in my previous webinars. I'll introduce him. Why? Because I'm just inspired by his story, right? He cleared the whole MRCP in 7-8 months, part one, part two basis. And before that is a different story that he took 5 attempts for part one, and after that, sixth attempt, he cleared. I mean the part one in the sixth attempt, part two in the first attempt in 3 months, and simultaneously after just giving part two, he cleared paces also in the seventh. I mean that's a story in nutshell. Hi, Dr. Hani. So yeah,
all
I'm
right.
always
Thank you.
inspired by your story, by the way.
Thank you so much. Can you hear me well?
Yes, yes, yes. You're
Yeah,
audible.
so to be honest, I want to say that I can see there's 46 people who are still here after 2 hours of this session. So this means that
Yeah.
there's a lot of serious people who really want to go through this experience and do hard work, and that's just the beginning.
Yeah.
And I really want to acknowledge, not just because you're here, Dr. Shirag and Dr. Arshia, but I want to acknowledge your knowledge and dedication. You're very kind and you're really committed to the candidates. I've seen how you deal with candidates in different batches, and it's truly exceptional. Um,
Thank you.
you constantly update the course, and I've seen changes over the last, even within 1 year, we've seen different videos for the same topics being updated. The questions are being updated, and you really genuinely, you care about helping doctors and to succeed, and not just to succeed for the exam, but also to beyond the exam. And anyone who would even just simply watch this webinar will truly appreciate this. The reason I'm saying this is because as a trainee in the UK, I finished my training and I'm currently working here. Now, I've been involved in education of medical students, and I've seen lots of supervisors and lots of meetings. The answer to most of the generic answers of how to approach exams, for example, is just do some more, give some effort, keep practicing, and this is not enough. So the key for success in such exams, and not just passing with comfort, is not about doing the most questions. It's not about this question bank or that question bank. Medicine is medicine, but it is about the way you study. It's about the material you study, and it's about the right time that you do it. So you need a trusted source, and this is probably what we can be held accountable with in Intellect Medicals, is we're giving you a trusted source. We're giving you a strategy that we are sure that it works but it's all about you. And Dr. Chirag said it, that it's about you. How much you invest in your time, how much are you focused? And if you are working full time, you have your night shifts, you have your on calls, and you have family or you have other commitments, and you have life outside medicine, then when you have 1 or 2 or 3 hours, when you have a weekend to spare for studying, then at least be the most efficient. And this is what we respect. We respect that time is scarce and we need to be efficient. We need to be consistent. So we acknowledge consistency. And this is how, for example, Dr. Asha mentioned about the WhatsApp group. The WhatsApp group, to be honest, between me, Dr. Chirag, and Dr. Asha, we're covering the 24 hours time zone because we live in different parts of the world. So, and also there's different candidates. You're not just, it's a global community, to be honest. It's like a small number, but it is growing, but it covers all across. You'll be surprised about people who are doing it from all across the world. So, you won't feel you're lonely. You won't feel you're isolated. If you've done this exam before and you're reattempting, then well done. That's the spirit. You just need to carry on, but carry on with a better approach. And you'll have a journey. It's a journey with others. So, and with people who you can hold accountable with the guidance that you need. And if you have a specific situation, let's say, I'm not sure if Dr. Chirag want to talk about this during this webinar, but we're offering like one-to-one sessions pre the course or even during the course to talk about personalized plans. And I'll leave it to Dr. Chirag after I finish talking to talk about this this opportunity, because sometimes we need to speak to someone and tell them what's been happening. And we've all been at some point talking to friends or even supervisors, whether clinical or education supervisors within your training, or even as a trust grade doctor in the UK, you get these meetings. But how efficient are they? And to be honest, they're mostly a formality. It's just a tick box that you've had the meeting to put in your portfolio. But we appreciate that, and we're trying to improve it, and we're trying to give genuine advice. I think most of the questions asked here are covered. And I just want to mention one thing because it is important. This is not just a weekend course. This is not a 2-day course that you have to take study leave for, and you have to travel and book hotel and then go there, and that's it. No, this is a 3-month course. So from start to finish, and even if you decide to book the course from today, you will get access. You can get ahead, start preparing, take it things slow until the 16th of August when everyone launches and starts with the same pace. So it's a day by day until the exam day. So I want you to appreciate the efforts and the time put behind this. So it's not just a question bank that you buy the subscription and you do on your own pace and you get to choose when, but there is a plan. And the most beautiful thing is about the spaced repetition that was built in the schedule. So if you see the schedule, I hope you managed to take a screenshot, or you can even watch the webinar. It's going to be recorded. You will see how cardiology, for example, you start with cardiology or neurology, and then in a few weeks, you have a catch-up week where you get to revisit that again. And then in 7 weeks, you're going to have like a 4-unit and then a 7-unit mock. And then there is the grand mock. So for example, just cardiology, you will encounter it at least 3 times within this period. Plus, questions will be placed and ideas and topics will be talked during the WhatsApp group every other week. So you'll see lots of cardiology within the 3 weeks. So by the time you reach the grand mock, which personally I think this is your scale, this is the time you should consider it as your actual exam, then you've covered most of the topics 3 times. I'm not saying you've done it 100%, but you've been through ACS a couple of times, you've been through Parkinson plus syndrome a couple of times, you've been through the difference between for example the endocrinology topics where they look similar, or diabetes cutoff point. So when you have this spaced repetition, you basically reach the exam, everything is fresh and it's there, and you've just had these bullet points every now and then in your head. And not just that, you finish the mock, the final mock, which is the grand mock on the, I think, the first week of November. Then you have a crash course. It's like every day or every other day you get to revise everything until the day of the exam. And this is probably what made the biggest difference in my own journey, especially with part one, because we know the knowledge is there and we understand it, but it's how to retain it and how to be ready and just go in, read the question. You've been through this idea, you've been through it multiple times and it's fresh, you answer with confidence. Or you're not sure about the answer, but you've been trained how to deal with tricky questions. You've been trained how to deal with questions that you've never encountered, and you've mastered the art of exclusion, because this is what makes the biggest difference. How to find the right answer and how to exclude the wrong answer, leading you to the correct answer. So I hope that you have a good think about your plan. How will you approach it? And hopefully will be part of your plan. If not, then at least you'll be inspired about the way we approach this exam. And for anyone in the UK, I can say that this course we've checked with multiple trusts across the UK. You can claim the budget for this. So it's not like a question bank, because some of the trusts, they do not refund question banks, especially if you're a trainee. However, this course is a live course. It's a long course, and the price of the course will be refunded by your study budget, whether you are a trust grade or you are a trainee. And I've been personally in contact with multiple people, including myself when I did the course a while ago, and you can claim it back. So it's a great opportunity, and you won't find that extensive course anywhere. And it's not just a question bank. It is a question bank. It is a theory lessons. It is interactive. So don't just prepare to pass this exam. Prepare it well. Enjoy the process. Try to make sure that your aim is to become more confident physician with a team that supports you all the steps throughout this journey. And I'll leave it to you, Dr. Shirag, now, and I'll carry on with my journey.
Yeah, thank you so much. Thank you so much, Dr. Hani, for sharing, and obviously Dr. Arshia as well for having those feedbacks. And you just mentioned precisely what is required, both of you, and especially Dr. Hani, when you talked about the doctors who are working in the NHS. And now there is one question which is being asked by, I believe, Dr. Shoaib regarding the Q Bank, and Dr. Pranav as well. But you want to sit for the exam in February. So I would say yes, February, this whole batch, which is starting from 16th of August, will end on 25th of November. So the live thing will end, but you will have access till the next 6 months, right? Till your next exam date also, you have the course access. You have the recordings, you have the PDF, you have the flashcard, everything which is there, you have till your next date itself, right? I'm just telling you for your diet, right? But again, my suggestion would be start early, because the more early you start, the better it is. Otherwise, when you have in mind that, okay, I have to go with my exam in February, what happens is around November, when we are starting our next batch, you will be in the same mindset. You will be again like, oh, I have to start. And then 3 months somehow can be somewhat pressurized, right? When you have time, when you are planning to sit for February diet, definitely you should start right away. And if you wish to join the next batch, you are most welcome. That is in end of November or December. I would say the first week of December. It's up to you. Whatever you decide, it's up to you. And about the Q Bank access, Dr. Arshia has already answered that access will be available for the next 6 months. Yeah, okay. I think we have agreed. I would like to give on November, but not getting the confidence. I totally understand, Dr. Jasim. So you haven't just started, right? So you have to start. Once you start, you will get the confidence. You get to know, okay, these are the questions being discussed, right? And you have already joined a few days back itself. So once we start our batch from 16th of August, I think you are a doctor from the UAE, Dr. Jasim, if I'm not wrong. Are you the same who joined a few days back? Okay, yeah. So we haven't started our batch, right? We have to. So you just got a recordings of the neuro and the cardiology plus the Q bank also. But once we start, you will see the interaction. You will enjoy those interactions. You will have those discussions on a daily basis, and you tend to understand this as what it is. And you can speak with us, as Dr. Hani mentioned, that you can speak to Dr. Hani, to Arshia, to me, whenever you feel you are losing it or you are not at all getting confident. Should you register or should you not? I mean, those are the important decisions, right? And I do not force anyone, I do not push just unnecessarily, okay, just write the temp. No, your attempt should be the good one, should be the best one. You should not waste your time. It's not about the money, it is about that impact on the confidence. So once you are ready, once you are like, okay, I am able to, I'm going average also by the batch, right? I'm not saying as a passive reading, as a passive scores in any of the Q bank. That is a passive. Over here, you can see your performance. You can judge, you can analyze yourself, right? Although I keep saying, do not just keep analyzing, just keep learning. Just keep learning where are you making mistakes, and then just keep correcting your strategy, right? And obviously, in your whole journey, we are there to help you and support you with all those questions, right? Not just the clinical one, not the non-acad. And especially the main question is, should we register? Should we go ahead or not? So anyhow, so I think that's it for today, and it was a good interactive session. I've already shared the link to join. Some of you have already joined. Dr. Naga, and there are others also who have already joined. So my teammate Brijesh will get back to you, Dr. Vasavi Naga, and all. So all those who have joined, so you will get a message from our team. Brijesh is the person. He'll get back to you, and he will provide you the access. As soon as you enroll, you will get the access to the cardio and neuro recording, right? So that you can start with the imaging thing, right? For the neurology, cover whole of it. It is covered in under 9 or 10 modules, right? So that you can cover it. It is about 6 hours discussion from the very basics to the advanced level. Everything, let's say, about GBS, myasthenia, peripheral nerve system, what are the causes, why it happens, what about the tracks, corticospinal and whatnot, right? And then second is cardiology, which has a full discussion about the ECG, how to approach ECG for, or how to interpret ECG, not for exam, but also that will help in your clinical practice, which I have got many feedback that I diagnosed this one and all those things. So again, have that approach that I have to practice, I have to learn for my clinical practice as well. Plus, obviously, exam is a short-term goal, right? You all have to clear it. Once you have started your journey, you have to clear it. And but your mindset should be, okay, I need to learn everything about all the arrhythmias and whatever it is. So once you enroll, you get the theory recording so that you have a kickstart. You can just start your prep even before starting the batch. Once you have seen those videos, once you have covered all those videos, you feel okay, I am at the upper edge or extra edge, I'm already ahead than the batch, right? So that is another benefit once you enroll, and I have already shared the link to enroll as well. So that's it, and thank you so much for being there, for being interactive, and I hope we have answered all your queries. If still your answers, still your questions are being unanswered, we were not able to answer, I'll just share. I mean, this is the email ID and the phone number is written below, right? You can take a screenshot, or even the phone number and the email ID is written over here. You can take a screenshot as well, right? And this link is valid until tonight itself. So why I'm saying so is because later on people they just come and say that, sir, we need that link, so that will get disabled. So that's it. Because I always consider and think about quality, right? It's about the quality, so that you understand what is to be read, and with your less time, with your let's say you have 2 hours or 3 hours, you need to know how to summarize your preparation. You don't have to go with other resources, searching here and there for the questions or for the explanations. Okay, that's it for today. Thank you so much for joining us, and you can reach out to us on this WhatsApp number, which is mentioned over here. Again, I can say you can take a screenshot. The email is also written, and you can reach out to us. We are always there, Dr. Hani, Dr. Arshia. So, and thank you so much, Dr. Arshia and Dr. Hani, and all those who have joined. We'll meet you in the batch, in the session itself. Okay, bye bye. Good night. Take care. Oh, I think there are some chats. Thank you so much. Okay, most welcome, for those appreciating messages. Thank you so much. Dr. Chirag, can I message you privately? Do you still have that same number ends with 77? Yes, Dr. Shoaib, you can message me, and I can see you were there in the workshop last year in London. You met Hani, right? So I saw that message, and I can now recollect you as well, right? So it's great to have you, and yes, you can message me on my Indian number. No worries. I'm always there to help. Okay. Okay, sir, same with me. Wanted to have a call. Dr. Shana, yeah, most welcome. You can have a call with me about your decision. Should you go with this one or the other one? And all those who still have a doubt, maybe, right? So should I or should I not? You can connect with that number. The N971 is a Dubai number. Brijesh is the person, is in our team, and he will connect with me. If at all you want to connect directly with me, you want to have a word with me before enrolling or having a decision made, that should I go with this batch or the next one, and when should I plan my prep, and all those questions, whatever goes in your head, right? Whatever you have, you can just have a word with me. No worries. Okay, thank you so much. Bye bye. Take care. Best wishes. Good night. Good night, all of you.